Thank you very much. Can I thank the organising committee for inviting me to speak today? I'm not sure how or why you found me to give this presentation, but I'm really delighted to be here. And can I also acknowledge the traditional custodians of the land on which I work, which is the Wongal people of the Great Eora Nation. So just a little bit about what I'll be talking about today. So I'll give you a little bit of background about myself and my training, and a relevant disclosure, and then a discussion on factors to consider when you're choosing your medical specialty. So different variables, the actual decision-making process, and then as I currently work in medical wellbeing, I'll touch a little bit about burnout and the impact of the work that you do on your relationships and work-life balance. And finally, I'm hoping I have time to give some lessons that I've learned along the way. So a little bit about myself. I actually did my undergraduate medical degree and internship here in Adelaide. I then moved to Sydney to pursue residency years and further training, and I was tossing up between physician training versus psychiatry. I chose physician training, and I pursued that, and during those years I got married. Subsequent to that, I chose the field of immunology, and I specialised in that, and went on to do a PhD, during which time I had a daughter. I then spent some time in doing a fellowship in Dublin, and came back and started work as an immunopathologist, and then moved on to my clinical immunology position at Concord Hospital, which I hold today. At that time, we had another very important addition to our family. And since that time, I've held some other roles at the hospital. So I've held the title of Director of Physician Education and Physician Training. I currently hold the role of Director of Wellbeing, and I've also held positions as Director of Assistance in Medicine. I've just come back from Stanford, where I've completed the Chief Wellness Officer's course, which is why I'll be talking a little bit about wellbeing as well. So what's my disclosures? My disclosure is I don't necessarily have expertise on this topic. So I've based my talk around published guides, a recommended approach, whatever evidence base I could find, and some personal experience. And I thank you all for listening today. So why is this topic important as you choose your specialty training? Well, according to the internet, the average person spends 90,000 hours or a third of their life working. And it's quite possible that medical people spend more than that, given that our hours, are sometimes longer. And what specialty you choose will impact upon not only your training experience, but in the long term, the sort of people you will work with, the type of work that you do, and the hours that you work. And these are all very significant, because not only will your choice of specialty impact on your work, but it is likely to impact on the other 2/3 of your life, as well as your relationships with others. And I'll talk a little bit about that. So what does Barbie tell us? Barbie tells us that you can be anything, and I think that is relevant when you're thinking about where your journey is going to take you. And there seems to be some wonderful fashion choices that seem to go with various career paths. And just so the Kens or others don't feel left out, there are also some options for Kens, albeit a little more limited, and perhaps with some slightly stranger fashion. So what is the vision? The vision when you start out is that and this is probably common to all, that you're looking to have a fulfilling career which gives you a sense of achievement and meaning, that you can attain the goals that you set for yourself and find joy in the work that you do. Most people like to choose a job that suits their personality and lifestyle and allows them to develop and nurture their non-career interests, their work-life balance, and their relationships, both inside and outside of work. So this from Stanford Uni, and I will go through it in more detail, are the recommended decision points or variables to consider when you're choosing a medical specialty. So going through them in more detail, so the first thing to think about is the training years themselves. Some training pathways are particularly competitive and may require you to do additional years or additional postgraduate education. Some training pathways are longer than others. The hours that you might be required to work are longer. And it's worth considering, does your chosen specialty allow for flexibility in training? Do you have additional exams or rotations that need to be undertaken that will impact on your life? And will you require post-training further education or fellowships overseas? The next thing to think about really is what interests you or what interested you when you were doing your undergraduate years. So were you more interested in clinical specialties, science-based things, or skills-based things such as procedural specialties? Were you interested in research and research methods, or any additional educational qualifications you may have undertaken? The type of career is another consideration. So do you see yourself long-term working in research, working in teaching, working in clinical work predominantly, or many positions and specialties allow a mixture of these things. And now going through, you can see that there are other types of careers, so hospital practice versus community-based, and there are a number of specialties that allow for both, and there are a number of specialties that allow for private practice also. The next thing to think about, and I think it's very relevant for a paediatric conference, that, the patient population that you'll be working with. So do you see yourself working with adults or children, remembering that children come with parents? Do you see yourself sort of more aligned with complex chronic care or acute management? Do you prefer looking after patients over a length of time or a single episode of care like you might see in the emergency department, in ICU or in anaesthetics? And how important is that physician-patient relationship to you? Or do you sort of want to avoid it and have a specialty with limited patient contact? So all the options are there when you're considering to make your choice. Another thing to consider is how handy you are, how dexterous you are, and whether or not you're interested in procedural training. So obviously surgical specialties, things like interventional radiology, have a high procedural component to them. There are some specialties that have a mix, so some degree of procedural components, and there are some specialties like endocrinology, immunology, psychiatry that have very little in terms of procedural components, if nothing. Another thing to think about is your work-life balance and what other aspects of your life you'll be balancing with your career. And this is where things like flexibility of hours is an issue long-term. The on-call commitments, so certain fields like surgery and obstetrics will give you a lot of on-call commitments, whether or not you're willing to undertake shift work or weekend work. And certain specialties, such as the surgical ones, may have longer hours, whereas other specialties may give you a choice to have more control over the hours that you work. Finally, earning potential is, the amount that you earn, is that an important consideration? And obviously some specialties are better remunerated than others, and some have the option of private practice. So it turns out there's an online quiz. And so when you actually have to make the decision, do you look at all these factors? Do you go to the internet and take this online quiz, which I did do, and I'll share the results that I got. So when you come to make the decision, there's a number of ways you can do it. So some people do it by a sort of a flowchart of exclusion, where you sort of cross off the specialties that you're not interested in. And I think that is a valid approach. The other approach is like a decision flowchart of inclusion, where you actually sort of seek out the things that you like. And I think either way works, but the advantage of looking at an inclusion rather than exclusion is that you might have excluded a procedural specialty, but then something like gynecology might fall under that. So just to make sure that when you're looking at either excluding or including choices, that you do consider looking at everything. So what did I consider when I chose a specialty? Looking at those variables that we've just talked about, I found that when I was studying sort of through my undergraduate and other years, that I found that immune-mediated disease is the most interesting, and I'm also not a particularly handy or dexterous person, so I didn't want any procedural component. I work in adult medicine, and I'm interested in complex, chronic, and continuous care of patients where I can establish a long-term physician-patient relationship. With my daughter and dog, and husband as well, work-life balance is important. So hours and flexibility was something that I did consider, as well as the option of going into private practice, which I haven't undertaken. So I took the quiz, and looks like I got it wrong, because the quiz told me that I should have undertaken psychiatry, and yet I am an immunologist. That clock is not actually counting down, so I have no idea where I am for time, but I will keep going. So just to talk about my other role, so currently I'm Director of Wellbeing at Concord Hospital, and so I've done some education, and I have a great interest in physician wellbeing, and I know that was touched on today. And when we talk about physician wellbeing, we look at Maslow's hierarchy, where to sort of reach the top of that pyramid and sort of be the best version of ourselves, there are a number of other aspects of our lives that we need to look after and nurture. And this is relevant because there is a high prevalence and risk of burnout amongst the medical community right now. And that obviously impacts on patient care. And I think my next slide shows the consequences of burnout. So burnout has consequences on the individual, but also on an organisation and the type of care that you give your patient. So I think this is also very relevant. And the reason I talk about it today is because you can see that different specialties fall under different places in this quadrant. And so on the x-axis here, you have a percentage of that particular specialty who report burnout. And on the y-axis, you have those that are satisfied with the work-life integration of their career. And so the best place to be is the top left green quadrant, and you can see the smug psychiatrist sitting there, as well as some other specialties. And it's interesting that some specialties, like say emergency medicine, will have high rates of burnout, but people that are still satisfied with their work-life integration. So I think it is relevant to consider this when you are choosing your specialty. So what's the opposite of burnout? The opposite of burnout is engagement, where you feel that you're energized and are fully absorbed and really finding joy in the work that you do. And there are a number of strategies to promote engagement. So looking after your wellness, resilience, contentment, physical and psychological well-being, and a number of other things. And these will factor in to you enjoying sort of your life and not just your work. So just to give you a little bit of data on the fact that the specialty you choose may impact on your relationships. So this is some data that was published a few years back, looking at the different specialties and their satisfaction with their relationship with children. Average comes out the internal medicine, and again, the psychiatrists are enjoying fantastic relationships with their children. And so just a thought that obviously this is not applicable to everyone, but the specialty you choose impacts the hours that you work. So the more hours that you work, it's been shown that these clinicians who work longer hours may feel or report themselves to have a lesser relationship with their children. So just something to consider also. Similarly, your relationship with your partner, it's not so much about the hours worked, but the graph on the left, it's about the mean time spent awake with your spouse or partner, which correlates with your satisfaction in relationship. And I don't think I spend very many awake minutes, or certainly minutes out of my pajamas with my partner. So maybe it's not fully applicable, but just something to consider. And so finally, to round out the talk, I just want to give you some lessons that I've learned along the way of my career. So firstly, go the Matildas, but choose and do something that you enjoy. So make sure that when you're making your decision, choose something that you can see yourself doing long term and enjoying. Regardless of what you choose, make the most of your training years. So your training years are where you can really sort of nurture different aspects of your specialty. It's the last time in your life where you can really say, I'm not the one fully responsible. So really make the most of every opportunity you have during that training time. And this is a photo taken in Adelaide, actually, of our group presenting some work at the Australasian Doctors Health Conference last year. Again, regardless of where you work, chances are you will have a team around you. And that team will have different skill sets, and you'll acquire mentors officially and unofficially along the way. So it's really vital that you learn as much as you can, not just during your training years, but throughout your career from your mentors and your teams. Embrace opportunity. So although I trained as an immunologist, a number of opportunities and alternative roles presented themselves along the way, and I was very fortunate to be able to take them on. So there's a picture of some of our assistants in medicine, as well as my team from the wellbeing team, and those that attended the Chief Wellness Officers course recently. So by taking on new roles, you can find that your career may take you in different directions. And I think this is relevant to my next slide, where, when I started training as an immunologist, never did I think I would end up on a cricket pitch one day, playing in a juniors versus seniors cricket match as part of our wellbeing team. So you may start somewhere and end up somewhere that you don't quite expect. Finally, be a lifelong learner. Embrace opportunities that you find along the way to attend conferences, education programs, or the various courses that really add to your experiences and your education that you can then pass on to others. As I've talked about, make sure you look after yourselves along your journey to prevent burnout. That gives you the optimum sort of mental and physical health yourself and allows you to optimize your delivery of care to your patients. And finally, nurture relationships and the non-work aspects of your life. So although your work will impact on the other components of your life, but it really is important to nurture relationships at work and also out of work. And finally, I'm not sure if this will resonate with everyone, but in Australia we call ibises bin chickens. And I was delighted to find an ibis outside my workplace being true to itself. So when you consider your specialty, be true to yourself. And thank you very much for listening.
Thank you so much. It's such an interesting insight that I think early in our careers, we spend a lot of time looking at those branched algorithms about how to choose which specialty. And I was reflecting that one of the other challenges is that particularly once you hit paediatric training, and I'm sure the same as for physician training, that you have that decision point again.
Yeah.
And I guess one of the questions that I had bubbling up was, at the point that you have to make that decision the second time, what that is differentiating between being, for example, a general physician
Yeah.
and an immunologist, or between a general paediatrician and an immunologist.
Yeah.
Can I ask what drove that for you particularly?
Yeah, so what drove it for me was that when you do your basic physician training, you study a lot of the specialties. So you're exposed to cardiology, respiratory, etc. And what I found is when I was studying for the written component of that exam, that I found in every specialty, the immunological diseases, I found the most interesting. Something that did put me off immunology slightly was the fact that you have to do additional exams to be an immunopathologist. So that's something people may factor in. But I think the long-term goal of the flexibility of hours, and I really enjoy both allergic disease and immunological disease. So, but it is difficult. It is difficult, and there are cases where people either don't necessarily get into the training pathway they want, or that they start one and then they switch to another one.
Thank you. I think that's a really tricky place, isn't it? Like, how do you get, let's say you are particularly interested in paediatric gastroenterology, but that is not your assigned 3-month rotation at the tertiary centre.
Yeah.
How do you recommend trainees approach that situation if they're interested in a specialty but have no exposure?
Yeah, I think that's my experience as well. So I started immunology advanced training, never having done a rotation in immunology. And so you do put yourself up to the possibility of starting a specialty that you may not actually enjoy. So I think the best way to approach that is to speak to people around you, speak to current trainees, current specialists, so you have an idea of what that specialty involves. Even if you're not posted in it, you can put your hand up and ask, look, can I do some clinics? Is it possible that I can do some clinics, see some consults? So, take opportunities wherever you can, but definitely speak to people, ask around what it means to sort of train in that specialty and also be in the specialty long term.
Thank you. Yeah, that's a really interesting point, isn't it? That when you're especially preparing for your long case exams, that's the chance to pop your hand up. Do you think that we should be selecting our specialties on the basis of future employability?
So that's something that people think about a lot because they think, I don't want to be a cardiologist because there's no jobs available. And I think my answer to that is that things change. So what the case is when you start your specialty is not going to be the job situation when you're finishing and you don't quite know, will you do some research overseas by the time you come back? So when I was overseas in Dublin, a number of positions came up at different hospitals and I wouldn't have anticipated that. So certainly within my own specialty, people take on other roles, they move on. So I don't think you should necessarily factor that in because things do change.
Thank you. Do we have any questions for our roving microphone? Yes, Tessa, we've got a question from Becky.
I don't know, I feel like there's probably a few people at a similar point in their career to me, which is between the BT and the AT, and there's this, and a few other people have said it, slump, I guess, post-exam, where you've worked for so long to get to this barrier and you've gotten past it and then you're like, now what do I do with my life? And you kind of love everything and you're like, is there do you have any advice of getting out of that slump? And because it's you just feel a bit aimless, I guess, is the best.
I think we see that slump year after year where the basic trainees see that exam as the end goal and they put everything they have into getting to that end goal. And I always remind them, once you've got that, you will realise everyone competing for the next level of jobs has it. So all of a sudden, the thing that you've worked so hard for, you realise, actually, at this point now, it doesn't mean anything. And so I think it doesn't mean anything because everybody's now got it. Because everybody's now got it. And so that's where that slump happens because you think, look, this is what I was working for and now where has that gotten me? And so I think it's important to realise that that's normal, that's natural, and everyone around you is feeling that. And then to look at the different specialty options. And I guess, take the online quiz, do some, look at some of those decisions that you make in terms of your training, and just sort of don't feel that if you choose something and it doesn't suit you, don't feel that you're committed to that. So, there is the option. There are plenty of people that change, that take some time out, do what's called a general year, a general senior resident medical officer year, where you can get exposed to more specialties. So it's not a rush. You can take your time. If you want some extra time to make that decision, then that's totally reasonable.
Thank you. I also think that there's no such thing as wasted training time. And we think a lot about basic training being those 3 years for paediatrics, and all the advanced training programs, to my knowledge, are at least 3 years, and that's probably the same period of time you'd spend in an undergraduate degree. So thinking of that as sort of day one of a new undergraduate degree, and what do you want to be at the end of that? Like, what kind of consultant do you want to be? Yes, we've talked about the specialty that you choose, but also it doesn't really matter what clinical experience you're acquiring. Your values bleed through in that time. Are you the kind of clinician who is willing to work absurdly long hours, or that you want that balance? And I love the way that your presentation really highlighted that. There is more to our careers than the specific clinical work that we have. And it's a time to really examine that. But at the same time, your rotations will contribute, especially to, Gen Peds training is amazing like that. You can do 6 months of acute care or 6 months of community, and either progresses you along your career.
And the other thing to remember is that within a specialty, there's great diversity. So even within the field of immunology, there's, neuroimmunology, HIV medicine, allergic disease, autoimmunity. So you may start a specialty, and I have no interest in all of those aspects of immunology, but you can find the niche that interests you and develop that as a career interest.
Thank you so much. Do we have any other questions from the audience? We've got time for one more up the front.
You seem to have held a lot of roles in your career and life so far, which is really impressive. I guess I'm just wondering practically, how have you managed to juggle those roles, plus family and the wellbeing stuff that you talked about?
So I think it's always a juggle. And I always tell people the juggle is difficult. So juggling, family commitments, non-work commitments. But I tended to work part-time in immunology. So at the hospital, I was half-time immunologist. And whenever you're half-time, people in the executive and the administration, they know you've got extra hours to give. And so they'll approach you and ask you. And so I think around the time that my daughter was in year 11 and 12, I just did the half-time immunology, knowing that I was able to take on some extra time afterwards. So it's when she graduated from high school, that's when I took on the wellbeing role. At other times, a lot of the jobs had a little bit of flexibility and they could do some work from home. And so I took them as kind of suited me, and I ensured that I was able to, do some of the job requirements from home, be flexible. Some of the jobs, like the Director of Assistance in Medicine, that comes up every sort of 2 or 3 months, and it's just a 10-week position when we have assistants in medicine placed at our hospital. And I did it once, and had I not enjoyed it, I would have said, look, this is not for me. But I really did enjoy it. So the whole time of my career, I have sort of, held different fractions in terms of the FTE I've worked. But I've been very fortunate to be able to juggle them based on the other commitments that I have.
Dr. Limaye, thank you so much.
Thank you very much.